Hi, my name is Miriam. I've been asked to do a self-assessment for my respiratory, cardiovascular, and neuromuscular system feels in a resting state. Then I will discuss my acute responses to the three systems after the 3 minutes of jogging followed with 3 minutes of push-ups. I sat for at least 5 minutes in a resting state. Then, afterwards, I ran in place for 3 minutes without having to stop. Then right away, I began doing regular push-ups. After 20 reps of standard push-ups, I changed it to modified push-ups, but I continued through until the 3 minutes were done. So my respiratory system during resting state, my breathing rate was at 7 breaths per minute. So what happens is the neural function of the brain communicates to the muscles that control the breathing. The diaphragm activates the lungs to inflate and intercostal muscles, which are the muscles attached to the ribs and help form and move the chest cavity. At rest, carbon dioxide pressure in the blood provides the most important respiratory stimulus. Small increases of pressured carbon dioxide during inhalation stimulates the medulla and peripheral chemoreceptors to initiate large increases in minute ventilation, which is the volume of air inhaled or exhaled each minute. During physical activity, I obviously had an increased number of breaths. My breathing rate was 34 breaths per minute. While I was exercising, a chemical factor known as hyperpnea took place, which is an increase in ventilation. Ventilation increases right away, and minute ventilation increases as well, and therefore meets the needs for the metabolic gas exchange. When activity stops, ventilation decreases right away to 40%, and then eventually comes down to resting levels. So in the cardiovascular system, during the resting state, my heart rate was at 74 beats per minute. One of the body functions that occur during rest is that the myocardium, which is the heart muscle, extracts 70 to 80% of the oxygen from blood flowing into the coronary vessels. Most body other tissues only use about 25% of the blood's available oxygen. Cardiac output, which is the amount of blood that pumps through the heart each minute, is 5 to 6 liters of blood in our body for 1 minute at a resting state. During and a few minutes after the physical activity, my heart rate was pumping much faster. My heart rate after the jog and the push-ups was 103 beats per minute. The stroke volume, which is the amount of blood ejected by the heart's left ventricle with each contraction, increases by pumping more blood because of the demand for oxygen. Since I regularly exercise 4 to 5 times a week, my heart rate increased slower than an individual who doesn't work out on a regular basis. If a person does an endurance training activity, whether it's their first time or haven't been working out in a long time, their heart rate spikes up rapidly. Also, my oxygen uptake is higher at a submaximal rate compared to a person who doesn't regularly work out. During physical activity, the cardiac output a person can average is 15 to 20 liters per minute, along with more oxygen extracted from blood. A professional athlete could have about 40 liters per minute. My muscular system. So during the resting state, the muscles were not moving, they weren't contracting, it was just resting. So just to circle back, after I did the 20 reps of standard push-ups, I changed it to modified push-ups because exertion was taking over. And I continued until the 3 minutes were up. During the push-ups, most of the upper body muscles were working, including the chest, the shoulders, and the triceps. The chest muscles, known as the pectoralis majors, was a primary muscle that took most of the load. The triceps helped with straightening and bending the elbow, and my shoulders and upper back muscles were also feeling tight as well. The neuromuscular junction transmits the neural impulse to initiate muscle action. Neuromuscular junction is a chemical synapse between motor neuron and muscle fiber. So during the push-ups, I was experiencing fatigue and did interval stops for about a second or two, but I continued on. Neuromuscular fatigability is a decline in which muscle tension with repeated stimulus per unit time. One of the factors was the reduced glycogen in the active muscle fibers. Even though the oxygen was still getting into the muscle, the phosphocreatine was depleting. And the adenosine triphosphate, the adenosine diphosphate, and the adenosine monophosphate were declining. The motor units help kicked in and helped me finish through the completion. So, lastly, the chronic adaptations with all three systems that would occur with long-term exercise. So the respiratory system with heavy breathing and air moving in and out of the lungs enhances gas exchange. The muscles of the respiratory system also improve, particularly the diaphragm and intercostal muscles. The improvements for cardiovascular system when incorporating aerobics exercises is the improvement with endurance. It also results with improvement of cardiac output and increase in blood volume for more filling in the heart ventricles and a larger stroke volume. And lastly, the benefits for muscular system is the increase of muscle synostosis hypertrophy. This occurs in the slow twitch and fast twitch muscle fibers, and the results increase in muscle strength and in power.